Hello, this is Dr. Colley, and this is a video to help prepare you for your shoulder surgery. Let's talk about some things that you can do preoperatively to prepare for surgery. One thing you can do to prepare for surgery is pick up Hibiclens from the pharmacy. This is an antibacterial soap that you can use on your skin to reduce the bacteria on the skin. I recommend using it the night before and the morning of surgery. Specific instructions are in the packet. Let's talk about your hospital stay. Your length of hospital stay is determined on many factors, including the surgery, your help at home, and your health status. Arthroscopic procedures usually go home the same day. If you're having an open procedure or a shoulder replacement, we should discuss our options. Option 1, if you have help at home and a good health history, we consider going home the same day after physical therapy. Option 2, if you have a complex history including diabetes, heart disease, or lung issues, or difficulty with help at home, we may consider staying one night in the hospital for next day discharge. Let's talk about everyone's favorite part of surgery, the sling. Depending on your insurance, we will either fit you for a sling at your preoperative visit, or you'll have to obtain one from a medical supply store. If you have to obtain one from a medical supply, please bring it with you to the hospital or the surgery center. You must maintain your sling at all times unless otherwise directed. I'll tell you when it's appropriate to remove your sling. You can remove your sling for bathing, eating, and doing your exercises. Other than that, it's your friend for full time. You cannot drive while in a sling. I know this is frustrating, but it is a danger to yourself and others on the road. Let's first talk about your pain control after surgery. You will be given a prescription for a narcotic medication. This is usually hydrocodone or oxycodone. If there is no Tylenol or acetaminophen mixed in, I do recommend you take Tylenol up to 3 times per day unless you have underlying liver problems. You can take 1,000 milligrams of Tylenol 3 times per day. Do not exceed 3,000 milligrams in a day. If deemed appropriate, you may be given an anti-inflammatory after surgery. This is usually Toradol or Ketorolac. I do not recommend taking additional anti-inflammatories such as ibuprofen, Aleve, or Motrin in addition. This is usually only taken for the first 3 days after surgery. Beyond that, I do not recommend anti-inflammatories as they can impair healing. Wait until 6 weeks after surgery to resume anti-inflammatory medications. You may be given a prescription for Zofran or ondansetron after surgery. This is to help prevent nausea and vomiting and is just a precaution. You may not need it, but please take as directed. Some patients are given an antibiotic after surgery. If this is you, please take as directed on the prescription. There are a few over-the-counter medications I recommend after surgery. 1, Benadryl. Benadryl is good for a number of reasons. Some patients can get itchy after surgery. This is usually from narcotic pain medication. It can also help you sleep at night. Sleeping, unfortunately, is difficult after shoulder surgery. I recommend you have some over-the-counter throat spray or lozenges, as general anesthesia can cause throat soreness. Another thing you need to watch out for after surgery is constipation. Pain medicine can cause constipation. I do recommend having Colace around and taking regularly until you have a normal bowel movement. If it's been 24 hours since a normal bowel movement, consider Miralax. If it's been more than 3 days, consider a suppository or enema from the pharmacy. Do not let constipation hinder your recovery. Surgery can cause stress on the body. There are a few supplements I recommend to take for at least 6 weeks after surgery. I recommend supplementing your diet with Boost or Ensure or a high-protein shake. Take this in addition to a healthy diet. This helps your body heal and recover after surgery. Calcium. Calcium is good for bones and mineralization. I recommend you take 1,000 milligrams a day of calcium to help you heal afterwards. Vitamin D. Vitamin D supports bone and immune health. You can take 2,000 units a day to help your body recover. Vitamin C. Vitamin C is good for a number of reasons. It supports healing and also boosts immunity. I recommend 500 milligrams per day for the first 6 weeks. Let's talk about some common questions I get after surgery. Bruising is very normal after surgery, especially open surgery. This starts at the shoulder, but can travel all the way down to the elbow and the hand. Swelling is also very common. Your hand can swell for weeks after surgery. Use your stress ball to help remove swelling in the hand. Ice is one of my favorite things after surgery. This is a machine you can pick up from a local medical supply store. They're very nice and convenient, but they can be expensive. If that's cost prohibitive, you consider getting frozen vegetables or ice packs from the pharmacy. I recommend having at least 3 on hand so that you can alternate to ensure that you're able to keep your pain and swelling under control. Heat. Heat can be very beneficial after surgery. This is really helpful when stretching or doing physical therapy. I don't recommend it for the first 2 weeks after surgery because of swelling. Once you start doing stretches and going to physical therapy, it's okay to use a heating pad or stretch in a hot shower. Sleeping. We already talked about this when we talked about Benadryl, but sleeping is difficult after surgery. Unfortunately, it's probably my patient's biggest complaint. You can sleep however is comfortable as long as you maintain your sling. Most of my patients tell me they'll sleep in a recliner, an adjustable bed, or propped up with pillows. Let's talk about showering after surgery. If you had an arthroscopic procedure, I recommend you remove your bandages 2 days after surgery. You can place waterproof band-aids over the incisions and shower normally. If you had an open procedure, please do not get your incision wet. I recommend you keep your surgical dressing on and dry unless it gets saturated. If it does get saturated, you may remove it and replace with a nylon dressing. Regardless, please do not get your incision wet. Now I'm going to show you a few exercises you can do starting the first day after surgery. I recommend you remove your sling 3 times per day to do these exercises. When you're in the sling, you can use your stress ball frequently to help relieve swelling in the hand. This also gives you a good forearm workout. Whenever you come out of your sling, I recommend you move your elbow, wrist, and hand 10 times up and down through full elbow range of motion. This helps your elbow from getting stiff. Also move your wrist up and down and hands open and closed. You can do this 10 times each time you come out of your sling. The most important exercise to do after your surgery are shoulder pendulums. These can be a little bit difficult for patients to understand, so I'll demonstrate them now. Bend over at the waist and support yourself. Try to get your shoulder at 90 degrees to your body. Don't fire your shoulder muscles. Use your body's momentum to move your shoulder. Move your arm 25 times each direction, the size of a basketball, 3 times per day. I still recommend you read the surgical packet as there are additional details we didn't cover today. At the end of your surgical packet, there's a checklist you can take with you to the pharmacy to ensure you don't forget anything. Finally, thank you for trusting me with your care. I take your recovery very seriously and will do everything I can to help you through this process.